Isaac Ben-Ezra, host and co-producer of Conversations. It gives me great pleasure to be able to introduce a leader and longstanding member of the Massachusetts Nurses Association, Donna Stern. Welcome.
Thank you, Isaac. It's great to be here.
I have a personal connection. I want to disclose it. The VNA, Visiting Nurses Association in Franklin County, out of Springfield, spent some time in my home in the last few weeks of my wife's life. So I have a personal connection with the intense importance of VNA at that time for a family in dire need. So it grieves me that the nurses in the VNA and the other nurses who are part of the system, the Baystate Hospital Corporation, are struggling today, 2 years after their contract expired, to try to renew that contract so that they could continue to do the kinds of things that all of us know nurses are capable of doing. So Donna is the co-chair of the negotiating committee for the nurses, and let's give Donna an opportunity to tell us where things stand and what we can do as a community to support quality care.
Thank you, Isaac. So just to let you know where I work, I am co-chair of the bargaining unit at Baystate Franklin Medical Center in Greenfield, Massachusetts, and I am a registered nurse. And currently, I'm also part of the Massachusetts Nurses Association, which you've mentioned, which is made up of 23,000 bedside nurses, 85 acute care hospitals, and it's the largest professional membership union for bedside nurses in Massachusetts. So I'm very proud to say that I'm part of such a great organization. And as you mentioned, we have been in contract negotiations with Baystate Medical Center, which its main hospital is in Springfield, Massachusetts, and our contract expired on December 31st of 2011, and we have been in contract negotiations since October of 2011. In fact, we just met with the hospital and completed our 20th negotiation session. And I think what's important for people to understand is that this is not a normal number. This is exceedingly high. Mercy Medical Center, which is also in Springfield, they just completed their negotiations in 6 sessions. So we're at 20 sessions, and that's in Greenfield. And then the other bargaining unit that's also in contract negotiations with Baystate are the visiting nurses, which you mentioned. The Springfield visiting nurses are also trying to fight for a fair contract, and they have been fighting for almost 2 years. And Baystate is comprised of just about 10,000 plus employees, and the only 2 unionized groups are my bargaining unit in Greenfield and the visiting nurses in Springfield, out of 10,000 employees. So we are of 209 nurses in Greenfield, and the visiting nurses make up about 57 to 60 nurses. So not a very large number in the entire healthcare system. And that's by design. Baystate is known as being anti-union, and they do everything and anything to try to keep it that way.
Are you getting support from other unions and the community?
We are, absolutely. We have gotten tremendous support from the trades unions, from other unions. We've been doing a public campaign, which we launched in February, and we've started doing, we did our Occupy Baystate on February 28th, which we had hundreds of people in front of the opening day of the new hospital, the Hospital of the Future, Baystate calls it. I think probably everybody has seen all the commercials for the Hospital of the Future. It's their new cardiovascular heart building that we call it the Taj Mahal Hospital, and it's about $300 million building. So on the same day that they were having the ribbon cutting ceremony, we launched our campaign to start bringing attention within the community about what's going on with us and Baystate.
It's a nonprofit corporation, but I use the term profit corporation instead of nonprofit corporation.
Well,
because I
yeah.
understand that their profits are in the tens of millions of dollars.
Absolutely. I think when we talk about the struggle just with us up at Greenfield and the nurses, the visiting nurses down in Springfield, I think it's important to have an overall context about what's going on with healthcare. We talk about it as the corporatization of healthcare. 60 years ago, you would go to a hospital and it would serve the public, it would serve the community, and it would have a public mission. And as we look at how corporations have taken over every aspect of our lives, healthcare is also part of that agenda. And so when I talk about the corporatization of healthcare, I'm talking about the hospitals, I'm talking about big pharma, and I'm talking about the health insurance companies themselves. And they're all aligned with each other, and they're all in it to make profits. And we say profits over patient care. And Baystate is no different. It's a huge healthcare corporation that has made $100 million in profits, and they would say, well, that goes back into the system. And I would say, yes, it goes back into the system to pay its highest executives very, very well. I mean, if we look at Mark Tolosky, who's the CEO of Baystate Healthcare System, and this is an old statistic, in 2010, he made almost $2 million base salary, and that, we're not looking at anything else. And that's just an example of, yes, where that money goes back into the system. They've also made a choice to hire Jackson Lewis, which is a nationally based law firm that advertises itself as, if you want to have a union-free workplace, please hire us. And that's who we are in negotiations against. Yes, we're working, trying to come up with a fair contract with Baystate, but they've hired Jackson Lewis. And they're spending thousands and thousands of dollars to try to break our union. So yes, that's an example of where those so-called nonprofits go. And it's all about choices. I mean, you could take that money and you could invest it in quality care, meaning investing it in your employees, making sure that you have proper staffing, making sure that you're not using mandatory overtime as your primary staffing mechanism for the hospital. You could hire nurses, hire more nurses. And right now, the Massachusetts Nurses Association is working very hard at making sure that that happens through a safe staffing bill, a ban on mandatory overtime, and also making sure that hospitals across the Commonwealth look at ways to prevent workplace violence. So we're working really, really hard at all of these things that we know that if they don't get taken care of, who does it impact? If you don't have proper staffing, if you're not taking care of your employees, then you're not taking care of the patients. And that leads to higher medical errors, it leads to hospital-based infections, it leads to so many problems that can be prevented when you take care of your employees and you take care of your nurses.
So there's a lot of part-time workers coming in.
That's correct.
To fill in space instead of hiring additional nurses at full-time, right?
That is correct.
Could you give us some of the examples of what happens when you don't have continuity of care?
Yes.
And I'm specifically thinking about a nurse working on a 12-hour shift, somebody coming in for 4 hours in the middle of a program and having to dispense with prescriptions and the error factor. I've dealt with this.
I'm sure you have.
I know that it's a problem, but I don't think that the community is so much aware of that. You want to describe some examples?
Sure. Well, if you look at If you look at the hiring practice and you look at how many hours nurses usually worked maybe 30 years ago, most shifts were based on 8-hour shifts. And as a cost-saving mechanism, hospitals switched over. Most hospitals now do 12-hour shifts. And if you have to work beyond your 12 hours, the risk of medical errors and making mistakes and compromising patient care is going to go up exponentially. And in addition to that, hospitals don't want to hire, they're looking at ways of hiring part-time employees or per diem employees as another way to not pay people benefits. I mean, if hospitals are always looking at ways to minimize their costs, and one of those ways is let's not pay people benefits. Let's not give them pension, let's not give them health care, let's not look at the basic things that people look at when they pick an organization to work for. It's getting harder and harder to get those traditional benefits that we all took for granted. And I think you can see that in the fight right now with what's going on with us at Franklin, and also what's going on at with the Visiting Nurses Association. One of the things that the hospital is trying to do is take away our ability to negotiate fair wages. They're trying to take away having to pay us overtime, including when they force us to stay. They don't want to pay us overtime for that.
Beyond 12 hours?
Beyond your shift. Now, I'm still an 8-hour employee. I'm rare. I work on a psychiatric unit, and most psych units still stay at 8 hours, but that's rare. So beyond your shift, they don't want to pay you overtime. But most nurses are working 12 hours. So beyond 12 hours, they don't want to have to pay you for that. They want to take away our collective bargaining over our ability to negotiate for fair and reasonable health care costs, health insurance costs. Health New England is owned by Baystate. That is the only health insurance that we are offered at the hospital, and they want to take away our bargaining rights over that. This is very strategic. They know if they can take away those rights, that they essentially can weaken our contract to nothing, which is essentially trying to break the union. So this is systematic. This is by design. This is a very clear agenda. And what's happening in Greenfield, and what's also happening with the Visiting Nurses Association, is happening across the Commonwealth, and it's also happening on a national level. Union busting, anti-union rhetoric, trying to change the way we do labor in this country and in this Commonwealth and in this area. And I think it's really important for people to understand that when you go into a hospital, the hope is that you're going to get the best and safest care by a registered nurse and other healthcare professionals. And hospitals have a different agenda. Their goal is how much money we can make in the leanest way possible. Lean production, we call it. And it's very scary.
You know what's scary? Baystate was one of two hospital systems that wanted to buy into Cooley Dickinson. Mm-hmm. And it seems to me that the anti-labor practices that's going on right now in the Baystate organization, while Cooley Dickinson just completed a 3-year contract with nurses, speaks loudly to, I think it's a contribution that the administration at Cooley Dickinson has made in recognizing that maintaining quality nursing staff means, in terms of this community, recognizing the right to be in a union and to negotiate in a fair way. So I think we all ought to take a deep breath, but that doesn't help. It doesn't help the Franklin people.
Well, I think it's important that you mention the Cooley Dickinson fight, and I also want to mention that those nurses fought really hard for that contract. It took a lot of time and effort to get that contract. The good news is that Cooley Dickinson eventually signed that contract, but that didn't come without a fight. But I think the other really important thing to focus on is why Cooley Dickinson didn't pick Baystate. And I think
Tell me about it.
I think you mentioned it already. I think Baystate at a corporate level does not have a good reputation with treating its employees well. And I think Northampton, Cooley Dickinson, that community rallied around that fact and said, I don't think we're going to go with Baystate. I don't think this is where we want to go. I don't think this is the direction we want to go. And I think it's an important wake-up call for Baystate and looking at, well, why didn't Cooley Dickinson go with us? And I think it's an opportunity, or it should be an opportunity, for the people at a corporate level to look at how are we treating our employees? How are we conducting ourselves? And I'm not sure that that's happening, and I'm not sure that's going to happen, but I think it should happen. Absolutely should happen.
Needless to say, the economic consequences in the valley to take the hospital population in terms of nursing staff at least, and put them into a lower income status without health care, without the kind of basic services that people have built into contracts, like a pension plan, further debilitates the unemployment picture and the economy. We need people working and providing a stable economic community, and that takes workers that are paid enough so that they can pay their mortgage and then they can be part of the community and support the services that we offer.
Yeah, I mean, I think everybody knows that when you become a nurse, you're not going into it to be rich. I mean, obviously everybody knows that, but you still want to be given a competitive living wage. You want to have health insurance that you can afford. You want to have a working environment that's safe. You want to have a ban on mandatory overtime. I think the good news is that the legislation is working at those things right now. I think we have 3 key pieces of legislation on the docket. One is looking at a safe staffing, which would require the Department of Public Health to limit the number of patients that any one nurse cares for. Right now, there are no limits on how many patients a nurse can have at one time. So you can have upwards to 7, 8, 9 patients at a time, which is really, really unsafe practice, puts patients at high risk. The other thing that we're looking at is a ban on mandatory overtime, which, as I've said already, the hospital industry, Baystate being one, is using that readily as a way to staff their hospitals, and the other would be to look at workplace violence. So these are 3 key pieces of legislation that could really change the delivery of health care in this Commonwealth and provide the safest care possible for our patients.
Now, the violence on the job, let's talk about that a little, and why it's not any different than safety in a plant, in a manufacturing plant.
Yes.
The condition of working on the job.
Absolutely.
Or before cigarettes were outlawed in Massachusetts in restaurants, the problem with secondhand smoking and the impact on workers.
I think workplace violence, I think people don't think of hospitals as being a place where violence can happen, but violence can happen in any setting, any place in the hospital, from the emergency room to the psychiatric unit to a medical surgical unit. And there's a number of factors that go into why workplace violence is increasing. I think one of the things that we're looking at is that people waiting long wait times in the emergency room can lead to frustration, can lead to violence. You're looking at people with substance abuse, addiction, mental illness, where there's less resources in the community, that the hospital becomes the sort of the safety net, the last place where people can come for services. There are a number of other factors that go into why workplace violence is increasing, but just in my time as being a nurse, I've had everything that you can possibly think of happen to me on the workplace. And what we're looking at is how can we make it safer? What are key ways that the nurses and the hospitals themselves can come together, come up with key strategies and looking at stopping or preventing workplace violence?
What are some of the ways that the nurses have in mind?
Well, one of the ways that the nurses have in mind is, well, one of the key things is if you provide more staff, if you increase your staffing, that means that you can provide
assistance at a critical time.
I mean, it's really pretty. It's common sense. That's
So
just one example.
It's directly related to understaffing.
Absolutely, that is certainly there. Are a number of factors that go into why someone may or may not be violent in a workplace or at the hospital. At the hospital, but when you look at strategies, if you don't have the right amount of staffing, that is definitely not going to help the problem. It's only going to make the problem worse. So that's just an example. We also proudly, the legislature in Massachusetts a couple years ago voted for the assault bill, which before it only allowed ambulance drivers to press charges when someone was violent, but now the assault bill now covers all healthcare workers, which is great. Everyone from doctors to nurses, dental hygienists, physical therapists. We actually have a way to press charges and seek legal support when we get assaulted at the workplace.
So when the hospitals sit down with nurses and negotiate, they're not against safety, but it doesn't register that additional staffing to support the work that's done day to day that's going to be provided.
I think what's important to recognize is who recognizes that as being really important and who doesn't. And if you look at nurses, mental health counselors, CNAs, everybody that's working in the trenches, and the middle managers, all recognize that that is key. But when you're looking at the corporate agenda, so you're looking at the people at the highest levels at Baystate, their values, their moral compass is different than ours. They're looking at the bottom line profits and how can we package things in a way that looks pretty. I mean, if you look at their commercials, their sleek commercials, their brochures, it all looks really, really pretty. But if you don't back it up with safe practices, one of those key ways, proper staffing, a ban on mandatory overtime, those two key things plus workplace violence prevention, then those glossy brochures mean nothing. If you're not providing the safe possible care, the safest possible care that you can, then we have a problem. And I think that that's where nurses come in. We know, we're at the bedside. We work with patients. We know what patients need. We hear what patients are telling us. We hear what family members are telling us. We're with patients at the key times in their lives when they're most vulnerable. And when you don't give nurses and other healthcare workers what we need to provide the safest possible care because you're looking at your profit margin, I have a problem with that. I have a serious problem with that.
You know, it comes down to who are the real advocates for health care and caring patients on a moment-to-moment, day-to-day basis. Who's with the patient 90% of the time when they're called on?
The nurses.
And
yeah.
I underline that because I remember in a variety of opportunities that I had to use the system that problems usually occur at night when there's an understaffing. And if there's 6 or 7 patients on a level in one of the areas, that are in need of care, and they all want to be taken care of right away, then you have to, there's a real issue with time response, and if there isn't enough nursing staff. So what we have is an overwork. I guess we could safely say that one of the unsafe conditions is overwork. Being called on in critical situations sometimes to be able to cover what sometimes is impossible to cover. So we get down to if nurses are, I won't use the word unhappy, but are unnecessarily stressed, that's going to impact on the patient. So I guess what we need to tell the community is what we can do, or ask us what we can do. And I think that's a good point to wind up this conversation. So what can the community do?
Well, I think one of the important things that the community can do is start, the very first thing is start making phone calls. Start making phone calls to Mark Tolosky at Baystate Medical Center in Springfield. Start making phone calls to Chuck Giganto, who is the president of the Baystate Franklin Medical Center at Greenfield.
Could you spell that last name?
I could try to spell that last name.
All right, why don't we put it, give us the stuff, we'll put it on after the program's over.
Absolutely.
So you're saying let's make some phone calls
right.
to negotiate.
Yeah, say, stop doing what you're doing.
We're the patients. We're the future patients.
That's exactly it. You're the patients.
We want a relationship with nurses that are happy on their job and that have the opportunity to take care of our needs.
Absolutely, and that's at a local level, and I could give you the website for Region 1, Massachusetts Nurse Association, Region 1 office that has a whole slew of things that people can do to start participating. But I think also on a state level, I think it's really important to call your legislators, both representatives and senators, to start pushing these key bills that I discussed, start pushing them forward, because these bills affect you.
Now, safe staffing has been something we're aware of.
Correct.
And it keeps getting put on the back burner. So that's one of the key things. Legislation that mandates safer conditions, that mandates some control over how many nurses per patient, under what conditions.
Correct.
Not all areas of healthcare are equal and don't require the same. But so we're getting down to our own healthcare system at a time when we expect to receive services. That if we tear down the system that keeps nurses with a living wage and good working conditions from being there, then we're sacrificing our own healthcare future.
Absolutely. And
it's been good talking to you.
It's been great, Isaac. Thank you so much for this opportunity.
And I know how hard you guys are working, but I think ultimately there will be a solution.
I agree.
And it comes out of organizing, as we know.
Yes.
Just a reminder that it wasn't more than 12 years ago when the community got behind the nurses at Cooley Dickinson Hospital. And we got, instead of a layoff of 25 nurses, we maintained the status quo. Nurses were kept on.
Yes.
And the benefit is to the community.
Absolutely.
The benefit is to the healthcare in the area. And they didn't go out of business.
No, they did not. And
so, give my love to
Thank
them.
you. I will. Thank you so much, Isaac. It's been an absolute pleasure.
And I know the community is with you, solid.
I know too.
But we just have to find a way to get that message.
Thank you so much.
And that's it for Conversations. I want to thank the staff and the volunteer students. Once again, we're finished for tonight, and I'll see you next week.